Clinicians and engineers from SingHealth have designed and custom-built a ventilator for COVID-19 patients who require breathing support. Now dubbed SG Inspire, it has unique features not found in conventional ventilators. It uses ambient air with the option of adding low pressure instead of high pressure gas and can be operated remotely.
According to the team behind the ventilator, it can be mass-produced at speed and costs 5 times less than a standard machine. The ventilator was developed to supplement the supply of ventilators in Singapore should the need arise.
To share more on this, we have the project lead, Associate Professor Derek Chan, who's also the Director of the KK Research Centre and Deputy Director of the SingHealth Medical Technology Office.
We're also joined by Dr. Jessica Kwa, a consultant at the Respiratory and Critical Care Medicine Department at Changi General Hospital. Well, Dr. Kwa, let's start with you. How does the ventilator work for COVID-19 patients?
Patients with severe COVID-19 pneumonia may have difficulty breathing on their own. The ventilator is a medical device that will move movable air into and out of the lungs at different pressures and oxygen concentrations. This will allow the patients with severe COVID-19 pneumonia to have sufficient oxygen delivered and carbon dioxide removed for life support.
Now, Prof. Chan, let's bring you in on this discussion. How is this ventilator different compared to the ones already in the market? In other words, why is it more user-friendly than conventional ventilators?
So this ventilator is designed to supplement conventional ventilators. It's basically meant to assist with COVID pandemic situation and essentially has the design features that it can be using a simplified interface, so people with less training can use less settings and basically still achieve the same result for patients.
Right. Well, Dr. Kwa, back to you. At what stage does the doctor decide that the ventilator is necessary? Perhaps only when the patients are in ICU?
Well, ventilators are necessary when severe pneumonia results in a dangerously low oxygen level. And this cannot be supported by conventional oxygen face masks that we have in the wards. So low oxygen levels can injure multiple body organs like the brain, the kidney, and the liver. So when patients deteriorate in the wards or in the emergency department, the ventilator device can be initiated at once. Thereafter, the patient will need to be cared for in an intensive care unit because monitoring of these life support devices require the expertise of a critical care physician, nursing and allied health team.
Now, we believe then that the ventilator is already in use. If so, how did the patients respond to the treatment, Prof?
So this is actually in the prototype phase. It's not in use in patients at this point. Fortunately, we haven't needed to put it into use, but we have been running this project essentially to be ready for the need should it arise.
Right. Well, Singapore currently has managed to keep the number of ICU patients low, and in fact, quite recently there are 0 ICU patients. So, Professor Chan, is there a market for the ventilator then in Singapore, and are there plans to export it for use overseas?
So this is designed not only for the COVID pandemic situation, but also for limited resource settings. It has the ability to be used in other countries who may be having less a positive situation than ourselves, and also in situations where they may have limited resources, and this system can actually be beneficial there where a conventional ventilator can't be used.
Right. Well, thank you, Professor Chan and Dr. Kwa. They were sharing more about a ventilator designed and custom built by SingHealth for COVID-19 patients who require breathing support.